أعزائي المشاهدين، نرحب بكم بحلقة بودكاست نسمات. أهلا وسهلا ومرحبا. اليوم نرحب بالأستاذ دكتور نيكولاس راي، زميلنا الفاضل اللي هو زايرنا من دولة بريطانيا المملكة المتحدة اسكتلندا. Nick, welcome to this podcast.
Thank you.
So we call it Nasamat, and Nasamat is a king of the sort of Akkadian, I think, heritage. It's like heritage in Iraq, and it also means breeze. And as you know, we hold a respiratory clinic. So welcome, and welcome to Iraq.
Thank you.
How's the trip been so far?
It's been excellent. Yeah, it's been an eye-opening experience, just seeing how things work in terms of both just life in general, the healthcare system, and both the setup in your clinic here with diagnostic tests, clinic and procedures, and all of the systems that have been put in place around that, and also just seeing how the hospital works, both in terms of management of patients, inpatients, and also kind of in the clinic space, and in the medical school as well, seeing how teaching is delivered in Iraq versus the UK. Lots of similarities actually and overlaps between those.
And you felt quite relaxed and
Absolutely.
Things are quite safe here.
Absolutely.
Yeah.
Absolutely. Yeah.
Enjoying the cuisine so far?
Yes. Yeah, absolutely.
Good.
Yeah. The food has been delicious.
Good. Brilliant, buddy. One thing that I was going to get your expertise in, being a consultant in infectious diseases. So we face a common dilemma, as you know, in respiratory medicine, internal medicine generally, and even primary care. We get seasonal changes, which increases the frequency of chest infections. And quite often people, which we think have clearly underlying viral chest infections, insist on antibiotics. What are your thoughts on that?
I think it's difficult, and we can always, as physicians, understand when patients want something, they want a treatment to make it better, but that's potentially causing harm in terms of collateral damage by killing off bacteria that, especially if you have a viral infection, antibiotics are not effective against viral infections. And all we're doing is causing side effects and collateral damage by killing other bacteria and not actually affecting the speed with which the patient will get better. And we know that antibiotics have got lots of side effects potentially, and both in terms of gastrointestinal side effects, some antibiotics have got a risk of sudden cardiac death, and there are a wide range of issues that can arise from antibiotics. So it's not just a completely harmless thing for the patient.
And you said that it can damage existing bacteria. Are you suggesting that there is healthy existing bacteria in the human body?
Absolutely. We know that our gut in particular is filled with healthy bacteria, and that is, the gut microbiome is hugely important for gut health. And antibiotics may disrupt that and may affect that. And that's one of the reasons that we see antibiotic-related diarrhea. It's a relatively common issue. It's a common side effect of antibiotic use.
Okay. And then when people come and see us, for example, and see a lot of my colleagues, etc., they're like, well, we're not interested in long-term resistance patterns, which is a bit of a shame. But, people's mindsets are, I want to get better. And they're thinking that we're holding back that, being a bit overcautious with it.
Yeah.
But it's not just about resistance, is it?
No, I think it's, we're giving a treatment that is potentially ineffective to a patient.
Yep.
And actually the whole, we're not, giving something just because the patient expects it is not always the right thing to do. And I think, we're kind of giving patients, their false hope and unrealistic expectations that this pill will actually get them better, when actually they will get better on their own.
Okay. And sometimes the patients say, well, doctor, it's clearly needing an antibiotic. My sputum's green. What do you think about that?
Well, I think, we know that, that sputum purulence is not always related to bacterial infection. And we can see it in people who've got viral infections. It's not a good marker for having a bacterial infection. If you've got underlying lung disease, or bronchiectasis, chronic obstructive pulmonary disease, then a much more volume to your sputum, or much more kind of muckier sputum, dirtier sputum, may be a marker for an infective issue. But if people who have got normal lungs, that's a lot. Just having dirty sputum or mucky sputum is not a reason to need antibiotics.
Okay. That's great. And we come towards the end of this short podcast. Hopefully it was short, concise, to the point. And hopefully you guys have benefited. In summary, people that come in with chest infections, the overwhelming majority have viral infections. They don't need antibiotics. You can make some exceptions to the rule when you have a picture that's clearly of a bacterial infection where people are not getting better or quite sick, but that has to be supported by clinical examination and radiology and other stuff. You also have times when you think you're doing a good thing, but doctors in general should only prescribe medicines or do any intervention in medicine if the benefits outweigh the risks. And there's always risk when you give medication. So the take-home message is we have to be weary of giving antibiotics unnecessarily because they're going to do more harm than good. And with that in mind, I thank you kindly, Dr. Nik Rae, for coming to visit us in Iraq. And hopefully this is the first visit of many.
Thank you.
Thank you.